What do MRI scans reveal about silent strokes? Imagine a tiny stroke happening in your brain without you ever noticing. That's what silent strokes are. They leave no obvious symptoms but can still cause damage. MRI scans are the key to uncovering these hidden events. When a silent stroke occurs, it damages small areas of brain tissue due to blockages in tiny blood vessels. These damaged spots are called infarcts. On MRI images, especially with a technique called diffusion-weighted imaging, these infarcts appear as small white spots or lesions. They are usually in parts of the brain supplied by small blood vessels, known as lacunar regions. MRI is incredibly sensitive and can detect these tiny lesions even when a person feels perfectly fine. Silent strokes are surprisingly common, especially in older adults. Studies show that nearly 20 to 30% of people who have never had a noticeable stroke still show evidence of silent infarcts on MRI scans. These infarcts often happen in areas that do not control obvious functions like speech or movement, which explains why they don't cause symptoms. But just because they are silent doesn't mean they are harmless. In fact, finding silent strokes on MRI is very important because they are linked to a higher chance of having a future stroke that does cause symptoms. Research indicates that people with silent infarcts are about twice as likely to have a major stroke later on, even after considering other risk factors like high blood pressure or irregular heartbeats. MRI scans, especially with diffusion-weighted imaging, can tell us whether a silent stroke is recent or old. This helps doctors understand the timeline of brain damage and assess the risk of future events. Detecting silent strokes allows healthcare providers to take preventive steps, such as controlling blood pressure, managing cholesterol, or prescribing medications to reduce stroke risk. It's a way to catch potential problems early before they turn into a major health crisis. In summary, MRI scans reveal silent strokes by showing tiny brain lesions caused by unnoticed blood flow interruptions. These findings are important because they serve as markers of cerebrovascular health and help guide preventive care. Recognizing silent strokes through MRI can lead to better management and reduce the chance of future, more serious strokes. Always remember, if you have concerns about stroke risk or brain health, consult a healthcare professional for personalized advice and appropriate testing.